What do you say to the caregiver that is going through relationship changes with the person they're caring for? Someone that they saw as strong, or that it's evolving. It's evolving as whether it's an illness or an elderly parent, and those roles shift. Any tips there for relationship changes, dynamic changes?
Yeah, I mean, I think step one is to acknowledge the change. Where I've seen people struggle, and this is both, in my personal life, but also as a clinician, supporting patients and their families through the course of a long illness, that it can be a real trip, like emotionally, it can be very jarring to go through that. And acknowledging the change is a really important first step. And, I think also to being patient with yourself and with your loved one. If therapy is an option, I do encourage that as much as possible. Now we have more and more options for low cost therapy too, which is just wonderful. But even if it's just talking with people in your life who can be a supportive listener, or if you know of anybody who's been through that, or if you find support groups helpful. Some people find them really helpful, others find them the opposite of helpful. I think it's important to be honest with yourself about that. But I think just acknowledging and giving yourself the space and permission to process those emotions that come up about those changes, very, very important.